Hi guys, I'm Dr. Justin McKinley, the dentist here at Urgent Tooth in Greensboro, North Carolina, and today I'd like to talk about dry sockets. What are they? Where are they commonly developing? What can patients do to keep them from happening? Dry sockets are a case of after a tooth is extracted, the blood clot that's initially in the bottom of that socket becomes dislodged, and the bone that's lining that socket and all those sensitive nerve fibers at the bottom of that bone become hypersensitive. Typically, they develop from the patient drinking something really hot and dissolving the clot, or from smoking, or from drinking through a straw and dislodging that clot. And when they develop it, they describe it as something that's way worse than the initial toothache that brought them in. Dry sockets usually happen on day 2 or day 3 after the extraction, and they'll last for about 7 days. Treatment is palliative in nature. I'll have the patient come in, I'll numb them up again, and I'll give them some dry socket dressing to kind of calm the pain down from inside the socket. But it won't cure it. It's something the patient has to work through. I find that they typically develop on lower molars. I can't think of a single example where I've had a dry socket on an upper extraction site. So usually lower molars, and it's palliative in nature for the aftercare. And the best thing that you can do is do everything you can to not have one by avoiding those things that I previously discussed. So hopefully that gives you some perspective on the dry socket.